Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Dr. Mukherjee, with you all once again. And yes, this is a rescheduled CME. The previous CME will be deleted soon. So you by then, I don't know if you're watching on a recorded version, you may not see the previous CME, like this CME on the previous part. So part 1 is available on our page. You can go watch over there. And also, other thing is that we this CME was yesterday. We were facing some network difficulties due to match, and maybe many like us also face the same situation with their network too. So that's why the curse has been done to Indian team. So that's a matter of different story. That's a different story. Let's just move on today's CME, and without wasting any more time, let's just count down to 30.
Good evening, everybody. Good evening, all the homeopaths across the globe and alumni of NIH. We are proud to host 134th episode of Continued Medical Education Session organized by National Institute of Homeopathy Alumni Association. I am aggrieved to narrate that our co-host, our beloved President Dr. Devnaran Kalyani is not keeping well. So he is not available tonight on live, but he will be watching the entire episode from his residence via YouTube. So let's all pray for speedy recovery of our beloved President, Dr. Devnaran Kalyani, sir. And we are really thankful to all our alumni who had been watching yesterday, but had been cooperative enough to bear with us, as due to network challenges, we had to reschedule it for the first time since 2020, and we are having it tonight. So I'll request our inaugurator tonight, Dr. Laxmi Mahto, to inaugurate the session, and I'll also request her, ma'am, to be my co-host for the session. Over to you, Dr. Laxmi.
Very good evening, sir. Thank you so much. I had this pleasure being here. And thank you for this co-host. I also pray for the speedy recovery of Dr. Kalyani, sir. So let us officially begin today's CME. So first of all, I would very good evening to first of all the respected moderator, sir, who is Dr. Avijit Burman, sir, and our enraged speaker, Dr. Sanjib Sahoo, sir. All the alumnus, and a special thanks to Bidyut Mukherjee sir and all dear students. A very good evening to you all. It is really a great pleasure to welcome each one of you in this academic journey, which is 134th online CME. Today's session is the first rudimentary of Materia, Medica and Insights through Toxicology, Part-2. It is a continuation of the session which we already had in the August 2025. That was the first part. So many of you might have attended the part 1, will remember that how thoughtfully the foundation has been laid down there, that how toxicology was correlated with the rudiments of Materia Medica. So that has given us the more clearer and more scientific understanding of the drug action. And for those who are joining today for the first time, this session will help you to see Materia Medica from a very different perspective, in more deeper and more analytical perspective. We often study Materia Medica as a collection of symptoms. So today you will be able to look beyond that memorization. You will be able to reflect more how the remedy is creating certain effects, how the toxic manifestation is drug pathogenesis में, how toxic manifestation is explained, and how it can help in the rational prescription. So in this, Dr. Sanjib will be correlating the toxicological principles with homeopathic drug pictures. Okay, and again to the NIH Alumni Association, I I am thankful to them for this consistent academic vision which they are providing since 2020 in organizing such meaningful CME session. Sessions like this encourage the critical thinking and help many students for their interdisciplinary integrations. Okay, a brief note about Dr. Sanjib Sahoo. He is the alumni as well as the faculty in the National Institute of Homeopathy. He is assistant professor in the Department of Forensic Medicine and Toxicology at NIH. And today he will deliberate the concept which will introduce and give you the more deeper knowledge about the Materia Medica with the renewed clarity. So I would request everyone to listen to him attentively, and in case if there is any question, to put up the questions in more clearer form and discuss it with him so that he can explain in more clearer way. And thank you. With this word, I formally inaugurate today's CME session, that is 134th CME, and wish the today's session to be a great success. Thank you. And at last, I would like our moderator, sir, Dr. Avijit Burman, sir, to please come and take the proceedings further. Thank you. So over to you.
Very good evening to all of you. I'm extremely thankful that this 134th CME being conducted by continuously uninterrupted by NIH Alumni Association, and this is the second part of the previous one, which was held in August 2025. Topic being first rudimentary of Materia Medica and insight through toxicology. This is the part 2, and today again, my dear student as well as presently the faculty, assistant professor of forensic medicine, Dr. Sanjib Sahoo, will be speaking on this occasion. And I think it's not needed to extend my deliberation further. Let us wait. We are waiting eagerly. We are waiting eagerly to hear from Dr. Sanjib Sahoo. I'm just handing over to Dr. Sanjib to start his deliberations. Thank you so much.
A very good evening to all of you. Am I audible clearly? Orko?
Yes, you are audible, sir. You are audible. You're clearly audible.
Okay. Yes. Very good evening to all of you. Thank you so much, Dr. Bidyut Mukherjee sir. Thank you, Dr. Narayan Kalyani sir. During my UG life, I have started my journey with the clinical tips of Dr. Narayan Kalyani sir when he was there in research in our research department. That time we used to go with my batchmates to learn some clinical tips or some clinics in the department of research. Thank you so much for giving me this platform, this opportunity to deliver, to speak something regarding the Materia Medica and toxicology. Thank you so much, Dr. Avijit Burman sir, my teacher, now my HOD, and Dr. Laxmi Mahto ma'am for your introduction. So without getting delay, we will jump into the topic. Is it visible clearly?
Sir, are you just do the slideshow? Now it's clearly visible.
So today's topic is first rudimentary of Materia Medica and insight to toxicology. We have completed the first part. This is the part 2. Okay. Before going to the main subject, we'll focus on this person. Name of the person is, he was a person of 15th century. Name of the person is Philippus Aurelius Theophrastus Bombastus von Hohenheim, popularly known as Paracelsus. This person was a Swiss physician. He is important in this context, not because of this historical some viewpoint, but he was the person who created revolution in the field of medicine during the period of Renaissance. I have studied his some of his books like Archidoxis of Magic, Aurora of the Philosophers, of a Happy Life, on alchemy, alchemical medicine, like that. He was the first person who talked about practice of observation, examination, and experimentation. And we all know that Richard Hughes, he expressed his gratitude in the introduction to the Boric's translation of Materia Medica that Paracelsus was the assailer. He introduced the chemical correlations in the field of medicine. One of his great words is everything is poison. Nothing is without poison, and only doses makes a thing that is not a poison. Whether a thing will be called as poison or medicine, the doses determines. Very important quotation in the field of medicine. He was the person who first told that the minus disease is resultant of the inhalation of the metal vapors, and it is not the punishment for the sin administered by the mountain spirit. At the time of Middle Age, that darkness of Middle Age, at that time, at that point of time, Paracelsus, he has the courage to tell the truth regarding homeopathy. We all know that the very basic principle of homeopathy is law of minimum, law of similars, like this. Law of minimum, before Hahnemann, or in many philosophers, they have talked about this. But thing is that Paracelsus, he practiced this in a different way, but he has practiced this. When plagues stricken the town of Starching in the summer of 1534, Paracelsus, he used to give a small pill which contains a minute dose of fecal matter of the plague affected person, and he rolled it with a small piece of bread, and administered to the patient, and he got success in this regard. So thing is that long before Hahnemann, Paracelsus practiced in a different way, not in the dynamized way, but in a different way. He practiced the minute doses of medicine. Even modern philosophers like Carl Jung, he said that Paracelsus is not only a pioneer in the domain of the chemical medicine, but also in those of empirical psychological healing science. He was the person who talked about the treatment of psychiatric patient in a different way, not in a torturous way. He told that a single spark can ignite a great heap of wood. Only a single spark is needed to ignite a great heap of wood. And he is telling, in this context, he is telling that very small dose of medicine can overpower a great disease. nowadays in 21st century we are talking, we are telling this is very easy, this is very much popular in the field of medicine. But thing is that in the 15th century, this is something very new. This was something very uh, authentic. Another very important contribution of the Paracelsus, that was, I found which is similar to the homeopathy concept. I have taken those points only. We are talking about the different routes of administration of drugs. Hahnemann is telling that the olfaction is a very potent route of administration of drugs. Paracelsus in 15th century, he said that the specificum odorificum, when patient is unable to swallow the medicine, as in apoplexy or in cases of epilepsy, olfaction can be a route of administration of drug at that time. And very important thing, though many of our homeopaths they have criticized it, but very beginning of the Materia Medica, the onset of Materia Medica, the doctrine of signature plays a very great role. And Paracelsus was the founder of this doctrine of signature. So this person, beside alchemy, he was an alchemist and he was a physician. So beside alchemy, his writings on the long life, it contains so many theories, it contains so many important observations which may enrich our knowledge. So moving to the next slide, I will correlate the symptoms of toxicology with the symptoms of Materia Medica and some medico-legal aspects. This is very important. We'll start with the drug Aconitum napellus. That in toxicology, the action on the voltage-sensitive sodium channel, which is more numerously found in the myocardium. We all know that the development of action potential is very much dependent with this voltage-sensitive sodium channel. We all know that in the development of action potential, the zero phase, that is the shortest phase and most important phase, the beginning of the action potential, development of action potential. There the poison aconite acts. Aconitin first stimulates and then paralyzes the peripheral termination of sensory and secretory nerves in the CNS and nerves of the myocardium. While ingesting this aconite, on ingestion of aconite, bitter sweet taste that will start in the mouth and severe burning. Severe burning will continue starting from the mouth, going towards the esophagus and down to stomach. So, and that is followed by numbness. This is the symptom. This is the initial most symptom of aconite poisoning. After that, patient will develop hypotension, chest pain, bradycardia, sinus tachycardia, and ventricular fibrillation, paresthesia and numbness. But here in aconite poisoning, the sensorium is affected at last. So patient will feel all the symptoms, patient will feel all the pain till the death. Pupillary athetosis, we all know that, which is known as hip push. This is alternate dilatation and constriction of the pupil with premotor permanent dilatation. So pupillary athetosis is very important finding of aconite poisoning. Excessive lacrimation, slow labored and shallow respiration. This will develop when aconite will affect the muscles of the respiration, and later on we will get some pattern respiration like chain stroke respiration. Okay. So these are some symptoms. Primarily, mental state is characterized by profound anxiety, terror, and a sense of impending death, agitation and restlessness, increased physical activity, anxiety or irritability, delirium, a state of severe confusion, and altered awareness, often accompanied by hallucination and delusion. Thing is that this is not taken from Materia Medica. This is the toxicological symptom. I have found that these symptoms in different textbooks, and this is cited. This is why this is I am emphasizing on this, because this is very much authentic, because it was published in NCBI NLM, National Institute of Health. These are the symptoms of toxicology. These are some toxicological symptoms. These are the mental symptoms of aconite toxicity. Before going into this Materia Medica part, I will cite one case. This is the case of a 34-year-old man presented to the emergency department of Central Medical College, Bangladesh, in the Dhaka at 3:45 a.m. with a complaint of numbness all over his body, weakness, shortness of breath, and drowsiness. And when the patient was admitted to the emergency, that time the patient party, the relatives of the patient, they explained the phenomena that the person, the incident was like that. The person was prescribed with some medicine, some herbal medicine, and they have shown the bottle. The problem is that this was the bottle presented by the patient party. They have presented, this case was presented, you can avail this. This case was presented published in the National Institute of Health library, that NCBI, authentic, very much authentic source. And they told that this is the herbal medicine was prescribed by some doctor for his rejuvenation of his stamina and general health. This patient took 40 ml of aconite mother tincture. This is the mother tincture. Obviously, you can see it. This homeopathic mother tincture, Aconitum napellus mother tincture, manufactured according to Homeopathic Pharmacopy of India. There is a manufacturing date is written, but expiry date is not applicable. This is the scenario. Problem is not with the patient. The problem is with us, and obviously with the manufacturing companies. If it is a case of herbal medicine or some Ayurvedic medicine or some other system of medicine that was prescribed, that was because of that patient is poisoned, accidentally poisoned, no matter. That is okay. This is a case. But thing is that our blood boils when we see that some homeopathic medicine in the name of homeopathy mother tincture, this is prescribed so without any clinical consideration, without any toxicological knowledge, haphazardly it is prescribed. At that time our blood boils. Thing is that here comes the medical aspect. So prescribing drug in a toxic dose or giving some toxic substance to the patient, this itself comes under criminal negligence. 304A IPC, section 304A IPC, and that is punishable. Criminal negligence is not like you are giving the compensation, but along with that, imprisonment with compensation is the sentence. And before going to this, I have asked this: what should be the legal position of certain drug? It is written. I have taken it from HPI, volume 9. Here clearly written that name of the drug, legal position, not to be prescribed below. Very important, not to be prescribed below. Anti-MRS should not be prescribed below 3x. Arsenicum album should not be prescribed below 3x. Ars iode not below 3x. Ars sulfuratum flavum not below 2x. Arsenicum sulfuratum rubrum not below 2x potency. Baryta carb not below 3x. Baryta mute not below 3x. Buforana not below 3x. Calcarea ars also. Lachesis not below 6x potency. All arsenic, barium, mercury, lead not below 3x potency. All nosodes not below 6x potency. And in practice not below 6 potency. That means 12x potency. Equivalent to 12x potency. All snakes, vipers, spiders, toad, insect poison not below 3x potency, except in India, Blata orientalis. We use this Blata orientalis in cases of asthma, in cases of chronic bronchitis. Mother tincture is very popular. And the last point, last but not the least, these phytochemicals, which is having some glycosides or some active principles, very toxic active principles, not below 6x potency. So prescription of aconite mother tincture, obviously that is legally a crime. And also this production of aconite mother tincture, whether it is written according to HPI, license number is written, batch number is written, doesn't matter. It is not a defense in the court of law. These things are not defense in the court of law. If the complaint arises, if the complaint is against the manufacturing company, then that is the end of this manufacturing company. So homeopathy is beautiful in its own way, not in the perverted way. So this is the perversion of the homeopathy, or we can say that this is the perversion of the homeopathic manufacturing companies. Thing is that in many cases, in the market, patent medicine are very popular. What is very painful is that this patent medicine, you can see many places they are using these medicines like arsenicum, sulfuratum, flavum, 2x, 1x, or like paracetamol 3x in the constituent. They are not following the HPA. So these are some things, some points that should be there in our mind while prescribing some medicine. Let's see what is there in Materia Medica. That Tessie mentioned that it has the reputation of being much more poisonous to the carnivorous animal than the herbivora. He has experimented it. He gave one elephant a dose of aconite which can cause death to 2,000 patients, 2,000 persons. That toxic level, that poisonous level, which can cause death to 2,000 human beings. And that level dosage was given to elephant, and that elephant showed no symptom. That was the experiment done by Tessie. It was aconite more than any other remedy which paved the way for the disappearance of the bloodletting from the general medical practice. It is given in Clark's Materia Medica that if China was the Newton's apple for homeopathic discovery, aconite was the remedy by means of which animal was able to meet the most of the conditions which in his day were treated by bloodletting. We all know that Bruchau's method of treatment. Bruchau was the person who Hahnemann told him as bloodthirsty Persian physician. So that person indiscriminately used this method, bloodletting method, for different kind of disease, like patient is having apoplexy, patient is having hypertension, patient is having migraine. Bloodletting is the mode of treatment. So Hahnemann, Clark is telling that Hahnemann made the most of the condition which was in his day was treated by bloodletting by this medicine aconite. Aconite in potency above third potency is perfectly safe. Third potency means third sentence plus potency. Yes. If we say the keynote of aconite, Richard Hughes he is telling that tension is the keynote of aconite. The tension in the mental sphere, tension in the physical sphere, tension in the sphere of cardiovascular system. All these, this is the keynote. Great and sudden sinking of strength, fainting on attempt to get up with anxiety, restlessness, numbness, tingling, and formication. Fearful anticipation of approaching death. Aconite patient, we all know that patient is having tremendous fear of death. Not only fear of death, the patient predicts that very time of death. Kent is telling that when the clock, the arms of the clock, when it reaches to a certain point, the patient will be in a collapse state. At that time, that when the arm of the clock that will reach to the 12, then I will die. So patient predicts the very much hour of death, which is there in toxicology, which is there in the symptoms caused by aconite poisoning. The delirium is unhappiness, worry, despair, and raving with expression of fear upon the countenance, but there is rarely unconsciousness. This is the symptom of toxicology. We have studied that the aconite patient is having so much restlessness, so much paralytic affection, a tingling, numbness. Along with the cardiac manifestation, there are some neurological manifestation too. But thing is that the consciousness is intact till death. So aconite patient is rarely having some attacks of unconsciousness, and here also our Materia Medica is in the same decision, in the same point. Attacks of paralysis in the epiglottis with tendency to choking, sensation of a compression and blows in the region of the heart. We all know that aconite is a cardiac poison. So we get many symptoms of heart affection. Pulse is full, strong, heart slow, feeble, head-like with anxiety. Sometimes it is weak, hard, and small. Dilated pupil, eyes sparking. We can relate this point, this ocular manifestation of aconite. It is there in Materia Medica. That pupil is dilated, eyes are sparkling, convulsed, and prominent, fixed, cannot bear the reflection of the sun from the snow. It causes specks, sparks, and scintillation to dance before eyes. Thing is that if we see the aconite poisoning manifestation in the eyes, it is written that there is dilated pupil, there are some sparks before eyes, constant lacrimation. Here we can correlate that. We all know that we have studied in our first PHMS that after foreign body extraction from eyes, if there is so much lacrimation, aconite is probably the only medicine in our Materia Medica. So after extraction of the foreign body, if there is so much lacrimation, aconite is the medicine. And where is the source? The source is toxicology. We'll move to next drug, that is digitalis. Another very important drug, cardiac poison, digitoxin, digitalin, digitalis are the active principles of digitalis. 2 to 3 gram fatal period is 1 to 24 hours. The glycosides of digitalis, it prolongs diastolic period. The toxic doses, it causes excitability with extrasystole. Very important that it prolongs diastolic period means there is some sort of interference with the conductivity of the heart. Arterial and ventricular fibrillation, there is lack of proper contraction of the heart. So arteries, atrium and ventricle, they fibrillate. Faintness, very importantly, digitalis is the this is the toxic substance which causes heart block. That means the impulses created by the AC node cannot reach the ventricular musculature. It is interrupted in between AC node and the ventricular muscle. Ocular manifestation, transient, amblyopia, scotoma, diplopia, color aberration. Very important. This color aberration is a very trademark finding in case of digitalis poisoning. We'll correlate it with Materia Medica. But let's see what is there in our Materia Medica. Before going to this Materia Medica part, digitalis toxicity, it is the toxicity, it is diagnosed obviously. Clinical diagnosis is there, but simple ECG can diagnose digitalis toxicity very easily. What is there in ECG? You can see it. I have given two graphs. In the first point, just see the ST. You can see the this ST segment. Obviously, ST segment is depressed. ST segment is depressed, curvature upward, and it looks like a typical term which is used by the radiologist that it is scooped out. It is scooped out appearance of the ST segment. Here we are not getting any kind of T wave. So T wave is absent. That is the flattening of the T wave. We cannot say that T wave is absent, but that is the flattening of T wave. Okay. And we can see here in the second ECG, we are getting abnormally large U wave. So increase in the amplitude of the U wave, scooped out appearance of the ST segment, and flattening of the T wave, that indicates digitalis toxicity. That indicates digitalis toxicity. And thing is that there is a very beautiful thing that Salvador Dali's Mostek. Salvador Dali's Mostek, look at his Mostek, it is like this. Very much looking like the scooped out appearance of the ST segment. So these are the manifestations. First point is that ST depression, the scooped out appearance of the ST segment, then flattening of the T wave, and obviously abnormally high amplitude, abnormally increased amplitude of U wave. Let's see what is there in Materia Medica. In the toxicology, we have found that this arterial and ventricular fibrillation, and here in Boric, it is telling that in the introduction, the first line is that its greatest indication is in the failure of the compensation, and especially when auricular fibrillation has set in. Obviously, after giving while drug proving, after giving digitalis 30 for subsequent 3 days, maintaining the strict homeopathic regimen, strict homeopathic principle, the patient will not develop the auricular fibrillation. The atrial fibrillation will not be there, and you will not get the features of atrial fibrillation in that patient. So in our Materia Medica, from where this symptom came? This symptom came from the first rudimentary of Materia Medica, that is the toxicology. So toxicology, this seminar, the motto of the seminar we discussed before this seminar, we discussed with, we means I and Professor Dr. V.C. Burman sir, we discussed that what to do. It is not possible to lay out an image that these toxicological symptoms, they are correlated with the Materia Medica symptoms. It is huge. It is enormous. We cannot fathom it. So what will be our motto in this seminar? Sir told that this seminar just put some slides or something that this can be a way of studying Materia Medica. Or the symptoms of Materia Medica, they have originated from these sources, from toxicology. And thing is that the very beginning of toxicology is very much painful. Why I am telling that? The history of toxicology is very much painful. Painful to hear, painful to think even. The symptoms of previously in Western countries, in basically mostly in Rome, in Japan also, the toxicological symptoms, they are recorded. How? By giving these toxic materials to slaves. Slavery was there at that time, so slaves were administered with the toxic materials, and they will develop the symptoms. Like there is a open area, the physicians are sitting around. The person who is poisoned with a certain kind of poison will be there in the middle. The slave will develop the symptom. The slave will develop the symptom till death, and the physicians or the doctors or whatever, the medical person, they were there to record the symptoms. In this way, the first toxicological symptoms recording started, like that of very similar to that of the anatomy. Because of this anatomy, many persons have dedicated their life, not in a normal way, but in a something abnormal way. We all know that the bark and hair cases, popularly again in our forensic medicine, it is taught as barking. That was only one instance. We all know that barking, but thing is that so many other instances where this murder was there to supply the body in the dissection hall. So many murders were there. So this toxicology also, the beginning is also very much painful. Okay, let's focus on this Materia Medica part, that the least movement causes violent palpitation and sensation as if heart will cease beating if he moves, like cocaine, just opposite to that of digitalis. Opposite to that of gelsemium. Digitalis patient says that when I am in the rest, there is less palpitation, but when I am trying to move, that time there is severe violent palpitation. Passive congestion of the lung, giving bloody sputum due to failing myocardium. Cannot bear to talk. Thing is that this is very much correlated with the heart block, the third-degree heart block, when the ventricular muscles start contracting in a very feeble way, like 20 to 40 per minute. That is the rate of contraction of independent ventricular muscle. So that time, there is cardiac failure. Ultimately, there is cardiac failure, and obviously the lungs are congested, giving rise to pulmonary edema. So in our Materia Medica, we are getting the clinical symptom, that bloody sputum, pink frothy sputum. Classically, it is there in pulmonary edema or pulmonary congestion, and this is because of failing of the myocardium. hemoptysis with weak heart, pulse full, irregular, very slow and weak, intermitting every third, fifth, or seventh beat. Very important. This is the symptom. This is the symptom which can be correlated with the digitalis toxicity. Digitalis toxicity causes heart block. So obviously, in the pulse, we will get some differences. So pulse is intermittent every third, fifth, or seventh beat. We can correlate with the MOBI's type 2 or type 2 heart block. Out of one atrial contraction, out of two ventricular contraction, one atrial contraction is there. Cyanosis is a feature of digitalis, mostly marked in extremities and obviously also in central part like in tongue, in oral cavity. So cyanosis is there in the digitalis pathogenesis. Let's move to the ocular manifestation of digitalis. Very important. I have told you that I have told that this is in digitalis we will get the color aberration. Patient cannot distinguish the color. In ocular manifestation or Materia Medica, dim vision, irregular pupil, diplopia, blueness of eyelids, dark bodies like flies before eyes, muscular volcantis. In the evening, upper part of the visual field seems shaded by a cloud. Changes in the acuteness of perception of shades of green, very important. Important in the sense that many color blind person cannot, this is the very commonest color blindness. Patient cannot perceive the acuteness of the shades of different shades of green. It is there in digitalis, and obviously this came from the toxicology. Yes, this is there in class Materia Medica that digitalis, the pathogenesis of digitalis in the sphere of heart, this can be compared with Adonis. We all know that Adonis is the medicine for after influenza or after rheumatism when heart is mainly affected, associated with dropsical condition. And of course, there is temporal headache mostly in the temples, and edema. So edema, high blood pressure, heart affected after the influenza or rheumatism, Adonis is the choice of medicine. And in Adonis, another thing is there, Bright disease, that is glomerulonephritis is there. And what is the indication? We'll get the oily pellicle over the urine. Iberish amara is the medicine when patient is having high blood pressure or hypertrophy of the heart. Along with that, there is a sensation, typical sensation, that is needle is through the ventricle during each systole. A chest pain will be like that, as if a needle is through the heart, to the ventricle during each contraction of the heart. Very important, and it is associated with vertigo and choking sensation in the throat. That is the keynote of Iberish. While prescribing Iberish, our teachers used to say that if there is no choking in the throat along with the heart symptom, Iberish is rarely indicated. You all know that Trategas is the medicine for increased arterial tension when there is crustaceous and calcareous deposits in the arterioles, arteries, and Trategas patient there will be insomnia. Insomnia is a concomitant of Trategas. In Materia Medica, it is written that insomnia of aortic sufferers, but thing is that if high blood tension is associated with insomnia, one of our choice is Trategas. Calmia we can differentiate with others medicine like Adonis. This is also is having rheumatic heart disease, but thing is that there will be the shifting pain, and the pain is directed downwards, like cactus, just opposite to the ledample. Pain is to upwards is the ledample and downward is calmia latifolia. And pain in the precordium associated with numbness of the part. So pain directed downwards in a rheumatic heart disease associated with numbness is calmia. There is another very important indication that I can remember that putting pain in the chest above the heart into the shoulder blade to the scapula. This is the symptom. We can find it in the Medica in the under cardiovascular manifestation. Spigelia, we all know that spigelia and calmia it should be differentiated. Spigelia is having obvious concomitant is head symptoms. Liartis spicata, when cardiac dropsy is associated with general anasarca, cardiac manifestation with general anasarca. Liartis spicata, it is in Medica it is said that this is a very prompt diuretic. It will remove the fluid from the body and it will restore the cardiac function. Convallaria meningitis and Liartis spicata, this can be differentiated. If patient is having history of patient is having history of smoking, and because of that heart is affected, along with that there is dropsical condition or there is some fluid accumulation, mostly in the dependent part, convallaria can be a choice. Okay, so these are some minute differentiation of this digitalis with other medicine, other heart medicine. There's so many things, but thing is that we can use this differentiation, find a differentiation in our clinic also. Now we'll move towards this tabacum. Nicotiana tabacum. The history of tobacco was there in the Western countries, obviously, and in the Cuban tobacco is very popular. Nicotine 60 to 100 mg is sufficient to kill a person. Fatal period is 5 to 15 minutes. It varies. It is very acute, but it varies 5 to 15 minutes. And tobacco, it is 15 to 30 grams is sufficient to produce the toxic effects of the tobacco. Tobacco leaves contains toxic alkaloids like nicotine, anavacin, lobeline. The main center of action is on autonomic ganglia, stimulation followed by depression. Obviously, it depresses in the long run. It depresses the autonomic nervous system. So we get the symptoms like hyperhidrosis. We will get symptoms like tachycardia, hyperhidrosis. We can get symptoms like anxiety. So nausea, incessant vomiting. That is the toxicological symptom, and it is also there in our Medica. Okay, let's see the severe symptoms. Tachycardia followed by bradycardia, hypotension, arrhythmia, angina pectoris. When angina pectoris is associated with severe sweating and nausea, one of our choice is nicotine. Angina pectoris, when it extends to the, we can differentiate the medicines based on the extension. When it extends to the jaw, there is another group of medicines like spigelia. It extends to the tip of the finger. We can think of the medicines like lactodector, lactans. Chronic respiratory symptoms like cough, wheezing, chronic bronchitis, dyspnea, because of this lobeline affects the respiratory symptoms more. Nausea, vomiting, abdominal pain, salivation. These are the symptoms. Chronic poisoning causes blindness, tremor, anxiety, impaired memory. There is a condition which is known as green tobacco sickness. What is that? The workers who are working in plucking the tobacco leaves, they develop a very peculiar type of health disturbances. Like they will develop constant nausea, they will develop abdominal pain, they will develop some dimness of the vision. So togetherly, this is known as this toxicodrome. Toxicodrome syndrome of the toxicology is known as green tobacco sickness. Very much similar to our manifestation of the tabacum. The therapeutic indication of tabacum is very similar to this green tobacco sickness. Let's see what is there in our Materia Medica. Barnett is telling that infusion of tobacco is a popular German remedy for scrofulous gland. Yes. Cooper, R.T. Cooper, this intermittent heart in old people is the indication of tabacum. Operation of the chest with anguish, constriction of the chest, like that of cactus. Sudden attack of extreme faintness, feeling oppression around the cardiac region, angina pectoris. R.T. Cooper is telling that single dose is relieved too much. If single dose is relieved much, not to be repeated often. Feeble irregular pulse and sensation as if a probe were pressed tightly from the right breast to the left till it came and twisted a knot around the heart, which stopped, then leaped violently. After the attack, heart missed every 4th beat. Important. Sensation as if heart has stopped beating, then give hum. We can see this symptom in Medica, like in aurum metallicum, sensation as if heart will stop beating, suddenly giving a thumb, like in Convallaria majalis and in sepia. So there are 3 medicines in which we will get this symptom, that sensation as if heart will stop beating, like that of tabacum, and suddenly giving one thumb. After the attack of angina, then heart missed every 4th beat. Very important finding. Okay, let's see. Sudden breaking up of cold, clammy sweat with much nausea, feeble, irregular pulse. This is the symptom, popular symptom of tabacum, which is also there while toxicology, during the toxicological or during the poisoning. Collapse, obviously cardiac collapse, cramps and tingling in the limb, restless, want to change the place continuously, because tabacum in its crude form, it causes tremendous restlessness, tremendous anxiety in the crude form, in the toxic form. So in Materia Medica, this symptom is also incorporated, that restlessness, want to change place continuously, is there in tabacum. This was a very popular case of Paul Kari in 1994, and that case was solved in 2024. So what was the case? The case was like that. In European countries, the age of the man is lesser than the age of his wife. Okay, it is there in many cases. It is there. So this person was 15 years younger than this lady, and name of the lady was Linda, and the name of the man was Paul Curry. So they worked in a nuclear plant. They were dating for 3 years. After 3 years dating, in 1992, he married Linda. On June 1994, this Paul Curry in the midnight, he called 911. So the police arrived, and Paul Curry was telling that my wife is not breathing. So police came, and they are asking that what happened. So Paul Curry, he is describing that she was having some perspiration, she was holding the chest, she was having tremendous chest pain, was restless, so much perspiration was there, and ultimately she had collapsed and died. A typical the presentation of heart attack. And there are some, as the case was sudden. So we all know that in sudden, suspicious, unnatural deaths, the inquest is carried out. So in Western countries, this medical examiner system is very much prevalent. And medical examiner system, we all know that forensic pathologists, they are there in medical examiner system. So they carried out the investigation, they had the autopsy, and in the autopsy, they found a very peculiar thing. Linda was not a smoker, but in Linda's blood, they got toxic doses of nicotine. At that time, they didn't get much evidences against this Paul Curry, and the case was the case was like that, unsolved case. That was termed as unsolved case. But later on, some relatives of this lady, they said that there is something, some foul play is there in this case. So again, the investigation started. When after 20 years, in 2014, the investigation again started, and they have found that this lady many times was admitted to the hospital because of some illness, and at that time, Paul Curry, he administered this nicotine in the IV bag. That intravenous fluid bag was given, and in that he injected the this nicotine, and this was repeatedly done, and the hospital persons and some CCTV cameras, they recorded that, and ultimately this Paul Curry was charged in the murder of his wife Linda, and later on the imprisonment was there. Thing is that why I have told this case in context of tabacum, okay, nicotinum tabacum, because many times we can found that this case looks natural. Some cases which looks natural may not be natural, and that type of eye or that type of mindset we should have. So persons of forensic medicine, they are always suspicious. Okay. Next, come to this point, resinous communities. I can remember one person who was very suspicious in our department. Okay. Resinous communities. Next, in toxicology, we can find these symptoms like burning pain in the throat, colic abdominal pain, vomiting, diarrhea. Volume depletion, ultimately death due to the circulatory failure. Resinous communis, it contains toxin, resin, a water-soluble glycoprotein. It is a very powerful allergen. That castor oil, it is prepared from this resinous communis. But thing is that the resin is excluded from castor oil. So castor oil is non-toxic, but resinous community is toxic. One of his compound of this ricinous communis is ricinoleic acid. This ricinoleic acid ester, they are having galactogov property. That means it stimulates the milk gland and it will increase the quantity of milk. It looks very similar. It looks very similar to this symptom. It is there in Boris Medica. Increase the quantity of milk in nursing women is ricinous communis, and this ricinoleic acid, this has some phytochemical activity. This phytochemical has some activity on the milk gland, having galactogov property. Let's see what is there in our Materia Medica: anorexia with great thirst, burning in the stomach, pyrosis, nausea, profuse vomiting, loose, incessant, painless with painful cramps in the muscles of the extremities, anus is inflamed, stool green, slimy and bloody. So the hints is there in toxicology. Later on, this has been included in our Materia Medica. This will differ. Obviously, this will differ. The symptoms of Materia Medica will differ from the symptoms of toxicology. Why? Because the symptoms of toxicology, we are getting the symptoms in the toxic dose, and Materia Medica, we are getting the symptoms out of the therapeutic dose. So this difference should be kept in our mind. It is not like that everything everything of the toxic symptoms is incorporated in Materia Medica. But thing is that is the hints which has been utilized by your stalwarts, and they have proved it in that way to get the finer symptoms. Those who are having the habit of novel reading, they perhaps can recognize this person. Case of Georgy Markov, 1978, the umbrella murder. Please wait for a minute. Probably I am audible and visible clearly. Yes, I am sitting in the place, the most, I can say that most appropriate place. I am here in the Department of Forensic Medicine and Toxicology of National Institute of Homoeopathy in the Forensic Medicine Department. This is our department. Okay, so the case of Georgy Markov, 1978, popularly known as the umbrella murder. Georgy Markov, this is the book written by him, The Truth That Killed, well-known novelist and playwright. He was the person of Bulgaria. The umbrella murder, why it is named so? Because he was very popular journalist also in the BBC, British Broadcasting Corporation. Very familiar face is Georgy Markov. While waiting in a bus stop in the Waterloo Bridge, this Georgy Markov felt some pain, sharp pain, like a sting of a bug or like a sting of a and like that in the back of his thigh. He looked behind and he saw a man picking up an umbrella off the ground. The man was facing away from the Markov. The man apologized. The man apologized and then hailed a taxi and left. Markov later remembered that the way of apology was made in a foreign accent. So that time, instantly, he cannot find any foul play. He could not find any foul play. But later on, when he was thinking about the incident, that this man was having some umbrella just at the time of that pricking pain. That time, at that time, person was picking the umbrella, and the person apologized. Why apologized is not clear, and apologized in a foreign accent. When he arrived his work, he saw that there is a blood clot just behind his eye, and his genes is blood stain, minute blood, minimum hemorrhage. And after that, he felt some pain. He had high grade fever and admitted to the London hospital. The next day he went into shock. The condition worsened and was not responding with the medication. After 4 days of hospitalization, Georgi Markov died in the London hospital. And the primary diagnosis of this cause of death was septicemia. Probably septicemia is causing some renal complication, renal failure, and he died. Later on, it was found that the Georgi Markov was poisoned with ricin. On autopsy, on medico-legal autopsy, it was found that his blood contains alkaloid ricin. It is very toxic, and the cause of death was that ricin. So this was popularly known as umbrella murder, the murder of Georgi Markov. Yes, ricin can be used as a weapon to kill someone, and obviously, no one will suspect that this resembles natural disease. This resembles septicemia, high-grade fever, probably a viral infection. After 4 days of hospitalization, the person died. This resembles a natural death. But this is the thing that murderers want, and that the condition will resemble the natural death, natural disease. Now come to another drug, proton peak. Protein toxoalbumin and protonocyte for burning pain from mouth to stomach, bulging, bloody stool. Skin is burning, redness, and vescication. Very similar to our Medica. That in the proton peak we will get the constant urging to stool, that gunshot stool, constant urging followed by sudden evacuation, like that of proton peak. We will get it in Tuja. Okay. Promedium. So, and in skin symptoms, very similar. Proton peak in material doses causes vescication, redness, and in our Materia Medica we will get vesicular type of eruption, which is very much painful, which is aggravation from touch, but slight rubbing, gentle rubbing ameliorates the symptom. That is there in proton peak skin symptom in our Materia Medica. So vesicles confluent using obviously ameliorated by gentle rubbing, and very much painful to touch. This is the last topic we will discuss. Opium is the toxic. It is a toxin, very popular toxic, very popular homicidal toxic. suicidal also. That fatal dose is only 2 gram, morphine is 200 mg, fatal period is 6 to 12 hours. So this binds with the opioid receptors, opium, mu. There are 4 types of opioid receptors: mu, kappa, delta, and OFQN. This is the newly added opioid receptors. Previously, there were three receptors. Activation of the opioid receptors results in the inhibition of the synaptic neurotransmission in CNS and PNS. So, thing is that a form of sluggishness in the neuron transmission is the pathogenesis of opium in toxic dose. So it causes inhibition of the synaptic transmission in CNS and PNS. Very important in the pathogenesis of opium. Yes. There is. We all know that opium is having. In homeopathy, we say that it is biphasic, but in toxicology, it is triphasic. So, stage of excitement, stage of stupor, and stage of narcosis. We can say that stage of stupor and stage of narcosis, this can be collected in a same category, but stage of excitement, it is somewhat very excitability is there, and this is the stage of depression. So, stage of excitement and stage of depression, this action, this biphasic action, it is there in our Materia Medica. So, opium causes CNS depression, opium causes peripheral nervous system depression. Sluggishness, painlessness, unconsciousness, it is there in the opium pathogenesis. So it is incorporated in our Materia Medica. See what is there in Materia Medica. That diminished irritability and inactivity of the voluntary, morbidly exalted excitability of the involuntary muscles, and loss of ideas and obtuseness of the fancy with faint-heartedness, along with that oversensitiveness of the general sensibility, is the symptomatology of opium, is the pathogenesis of opium. So it is very difficult because of its triphasic action of opium, very difficult to estimate the action, what is exactly is there. But in homeopathy, we frequently use this medicine in where the excitement is not there, where we are getting paucity of symptoms because of that defective vitality. To get the symptoms, to get the characteristic symptom, Hahnemann had advised this medicine. When it is because of that neural sluggishness, patient is unable to develop symptoms, opium is given. So, thank you so much. Thank you for your patience hearing. And it is not possible to discuss every drug from its toxicological point of view and from homeopathic correlation. But this is the thing I have tried. I don't know how I have if I am able to correlate this toxicology with Materia Medica. But this is all. Thank you so much.
Thank you. Thank you, Dr. Sanjib, for this nice deliberation. Yes, it's exactly what you have mentioned, commented at the end, that it is a huge topic, huge chapter. To correlate homeopathic Materia Medica with toxicological symptoms, it is really huge. And you have done justice. Definitely, you have done justice. In the first part of this seminar, you had covered a lot of topics, a lot of homeopathic Materia Medica drugs and correlated with the toxicological symptoms. Here today also you have pointed out, you have gone through mostly the cardiac poisons and thereafter some other poisons which are relevant, which are commonly used by us homeopaths in day-to-day practice. Now the thing is, to be very honest, from the very beginning, let me point out few points. Let me highlight few points which I want to share with all of you, the viewers and the listeners of today's 134th episode of this CME. You have just paid your homage, rightly so, to none other than Paracelsus. We should remember him. The students of the medical fraternity, basically, we the faculty, we the teachers of forensic medicine and toxicology, we should not forget the contribution of Paracelsus. Yes, all the students must remember him for his contributions in the field of toxicology. Then coming to the most important drugs related to the cardiac poison, it is, yes, the case which you have cited, a case in Dhaka using Aconitum napillus mother tincture is a blunder mistake. It is quoted. I want to repeat it. I want to request all the listeners and viewers, please go through what Dr. Sanjib had mentioned, the guidelines and the warnings and the cautionary which had been given by HPI in volume 9. So what are the drugs, what are the medicines we should be using very cautiously, and the potency, most important, the potency. You must be knowing that these are the heavy metals: arsenic, lead, copper, mercury, the compounds of those, different compounds. These are heavy metals. They do have toxicological effects, poisonous effects. We teach the students. We study heavy metals, mostly these four: arsenic, mercury, copper, and lead. We have medicines in our Materia Medica of these heavy metals. These are highly toxic, so we should be very cautious in using these products as our weapons in the be the homeopaths. Please go by the guidelines of HPI. What should be the minimum potency which should be avoided, and beyond that we can use it with caution. This is very important. And the case of Dhaka, aconite, using aconitum mother tincture, a whole bottle, probably a huge amount of that mother tincture was consumed and the patient died. I differ with Dr. Sanjib. He has used the word of perversion. No, I don't think this is a case of perversion. The drug manufacturing companies should be penalized. There is no authority to keep an eye, to keep and watch on these drug manufacturing companies. I don't have any idea that whether in India companies, homeopathic drug manufacturing companies, do prepare aconitum mother tincture or not. I may be wrong, but I don't know. But this case in Dhaka, using abundantly without any expiry date, and that too quoting the guidelines of HPI, but using in a malified way. This is simply ignorance. I don't believe that the drug manufacturing companies or the physicians do want to create harm or to kill their patients. But this is simply utter ignorance on the part of the physicians, on the part of the drug manufacturing companies there, who had been, rather still now, is probably producing these sort of medicines in such potencies, which are extremely toxic, which are extremely harmful. If they're used indiscriminately, can cause even death at any point of time. Because aconite is deadly cardiac poison. We all know it. One of our favorite drugs, favorite topics in forensic medicine, toxicology, aconitum napillus. So many symptoms we teach to the students, including the hippus, which is the alternate constriction and dilatation of the pupil, followed by the premortal dilatation permanently, that has been mentioned by Dr. Sanjib. So please be very careful in using these drugs. Again, after this, regarding digitalis, he had clearly mentioned, I would like to request the listeners, amongst which a lot of students must be there all over the country. Please keep an eye. A simple ECG, an ECG tracing can give you a quite good amount of inputs or hints whether it is a case of digitalis poisoning or not. With ST depression and scooped out appearance with T-wave flattened, and another in another case of in case of a highly increased amplitude of the UF. So please be careful. Simple ECG in these cases can help you a lot. Studying Materia Medica, yes, studying Materia Medica, when we teach forensic medicine in the part of in the chapter during teaching the portion of toxicology, we always emphasize upon reading, going by the side by side the homeopathic Materia Medica. Suppose we are dealing with aconite in toxicology sessions, we always advise our students go through the chapter of Materia Medica aconitum napillus and try to find out the similarities and the dissimilarities, mostly the similarities. If one can find out a student, if can find out the juice or the beauty of the toxicological findings, can easily correlate with the Materia Medica symptoms. That helps immensely in studying as well as remembering the symptoms of our Materia Medica. Now, next, going to finally nicely demonstrated, and in a very short time, Dr. Sanjib had tried to clarify or discriminate or differentiate Adonis, Iberis, Crataegus, Calmia, Spigelia, Latris, and Convallaria majors. In this regard, not to my senior colleagues and my elders, this is a small tip for my juniors, my students all over the country, those who are listening. Adonis, what Dr. Sanjib had said, beyond this, I can add a little bit. Please, you can note it. Adonis is our homeopathic diuretic. Yes, in a case of patient suffering from high systolic pressure, an allopathic physician will immediately advise one diuretic. What is the role of a diuretic? Will increase the urine flow, urinary output, which will spontaneously lower down the systolic pressure. This is beautifully done by our medicine, Adonis hornalis. You can use it with immense effect. Next, coming to Crataegus. Crataegus is a beautiful drug of our homeopathic Materia Medica, where we always, the most important thing to note is, it is not only the functional complaints related, obviously a case of hypertension, and complaints related to the heart and cardiothoracic system, cardiovascular system. Here, the keynote point which I should highlight is not only the functional complaints, but also structural complaints of the heart, which can easily be found out, not very easily in an ECG, but with your clinical observation. If you find it a little bit suspicious, immediately go for an echocardiography. That will give you a lot of inputs, whether the structures of the heart, the valves, and whether the left ventricular ejection fraction, whether there is any regurgitation or not. Everything, each and every detail, you can get it from an echocardiography. If you find such parameters, such structural abnormalities associated with hypertension, Crataegus oxycantha is one of our most valuable drugs. Next, one more thing I should highlight regarding Convallaria majalis. This Convallaria majalis, a keynote symptom is if there is or there are features of left ventricular failure, LVF. If there are features of left ventricular failure, please do not forget and try to remember Convallaria majors, which will be of immense help in your day-to-day clinical practice. So again, I once again thank Dr. Sanjib for highlighting and clarifying all these 6-7 drugs which are of immense value. Coming to tabecum, beautifully done. um, Paul Carey case, a good one, a very interesting case which he had described, and he had highlighted regarding the green tobacco sickness. And lastly, but not the least, here he had cautioned, quoting one of our stalwarts, that please be careful. A single dose, if it gives result, please do not repeat it. I can correlate. I can recall the warning given by our master Hahnemann at the end of Drosera. At the end of Drosera, my dear students, if you read, go through the Drosera chapter in Allen's keynote. At the end, there is a warning given by our master Samuel Hahnemann that a 30th potency, a single dose, is sufficient enough to bring out cure. And if it gives a result, please do not repeat it. Repetition will create harm. This is very, very important. In this regard, Dr. Sanjib was mentioning that the forensic experts do have a very critical and very their eyesight, their thoughtfulness, and their penetration into a case are really important. Here, I would like to request you, if anybody in and around Kolkata staying or comes off and on to visit Kolkata for some reasons or other, please do not forget to visit the heritage Calcutta Medical College and now the Kolkata Medical College. There, the forensic department, a two-storied building. If you go, that is a British period. The buildings were constructed during the British period. If you go to the first floor, climbing the staircase, at the junction of the first and the second floor, you can see a very prominent position. There is an wooden graffiti demarcating a huge eye had been created and impacted on the wall of the Department of Forensic Medicine. And below it, it is clearly mentioned that forensic eyes are deep and penetrating. Yes, I do believe that forensic experts have a very deep and penetrating eyes. Next, coming to the other medicines regarding Ricinus communis, croton tick. These two, we always, croton, our very important and popular drug, mostly used for diarrheal episodes, as well as you all know how forceful stool a croton tick patient creates, a gunshot stool type of stool. All these symptoms are found in toxicology or forensics toxicology. Ricinus communis, the castor oil, the ricin, highly toxic alkaloid ricin. Here, a beautiful case has been explained and cited, and the umbrella murder case of Georgy Markov by Dr. Sanjib. Thank you, Dr. Sanjib, for highlighting. Yes, I was not clearly aware of this case, umbrella murder case. You have found out, you have gone through the books and all the case records, and you have suggested and cited this case in this seminar. Thank you once again for this. And lastly, not the least, the opium. Yes, though it is mentioned in our Medica as a two-phasic one, but in forensic medicine, we explain it, we teach it under the three headings, though Sanjib has mentioned that the first two stages can be culminated and made into 2-1. Or mostly, the symptoms are very alike in Medica as well as in toxicology. They are very much alike. So what is the take-home message from this today's 134th CME? Is that if you read, the students, mostly the students, if they read toxicology with a passion, with a sense of love, going into the insights, deep into it, trying to understand the reasonings behind, it will be much easier for them to correlate with the symptoms of our homeopathic Medica. And that will give them a lot of help in their day-to-day practice and in the days to come. Thank you once again, especially to the organizers, to my very dear friend, Dr. Bidyut Mukherjee, for continuing this CME program under the umbrella of NIH Alumni Association since 2020. it is not a matter of joke. And a Herculean task he is carrying on along with his fellow alumni rather. He is continuing this. I should request him not to stop and proceed this to carry on with different subjects as he had been doing so since last 5-6 years. And here once again, thanks to Dr. Laxmi Mahto for beautifully narrating and highlighting the importance correlating toxicology with homeopathic Medica, and to start this proceeding of today's. I pray to the Almighty for a speedy recovery of our dearest Dada, Dr. Narayan Kalyani, so that he becomes much more fitter than the previous days, and he comes forward. We like to see him in a smiling face, sitting in front of us and guiding all of us in the days to come. Thank you once again to our day's speaker, my dear Dr. Sanjib Sahoo, for such nice deliberation and winding up this topic of first rudimentary of Medica and insight into toxicology. Thank you so much. And I should want to thank Dr. Orko Mukherjee also, because he is the person who is doing all sorts of taking the pain to create these things, to connect each and every people in daily practices. And whenever we are in trouble, yesterday I was really in a trouble, and most of us were due to some problems in the connectivities problem. He had been always without any always he was on his toes to help us in finding out solutions. Thank you so much, and good night to all of you. And I am handing over to Dr. Bidyut Mukherjee to wind up this session. Thank you.
Thank you so much. And it's so much academic. Dr. Laxmi, is she there? Orko, do we have Dr. Laxmi with us? We thank.
No, sir, no, there is not.
Okay, we thank our beloved Dr. Sanjib. We are proud to have such alumnus among us. And there had been a very enthralling session. We got certain comments, something to add. We had requested medical lecturer 5690 to reveal the identity. And if you have certain inputs, please send it in our mail or in the comment section where you can write in details. And we'll be discussing the same with Dr. Sanjib Sahoo and our moderator, Professor Avijit Shee Burman, sir. Thanks, everyone. Let's all pray together that our beloved Dr. Kalyani, sir, be back as a co-host in this CME, because it is because of his inspiration, along with the Minister of Ayush, our previous directors, the present director, and the faculty of NIH, we had been able to continue it since June 2020. And we are determined to continue with this CME sessions and appeal what Dr. Kalyani used to do to all the alumni who are watching it now live and will be watching in the latest version. Never hesitate, get in touch with me, get in touch with your fellow alumni, fellow professors whom you are in touch with in NIH, because in NIH Alumni Association office, we used to sit at least 3-4 days a week. So getting in touch with us is not a big challenge now. Even you can WhatsApp us, be a speaker, come forward, share your knowledge and help us to learn from you also. Because this is a learning phase. The main purpose of this CME is to share the knowledge and enrich our own selves. We have certain various topics, burning topics we are pondering upon, like the recent NCH guidelines, which is very bit confusing. There are a lot of things to ponder upon that, especially the persons who are private practitioners like myself. So those alumni and the other homeopathic fraternity brothers and sisters who are watching this, please come up with your suggestions. What questions can or what type of CME we can have on this. We are planning to have a panel discussion with the recent updates of NCH amendments. So we request everybody to come up with your suggestions. You can send it in our mail, nihalumnimeet@gmail.com, or the other details are given in the description of each and every CME we are going live. Please go through the details and send it to us. We are committed to give more and more better information. Thank you. And with this, we are returning to the backstage editor, Dr. Orko Mukherjee.
Thank you all. Thank you, sir. Thank you, Avijit sir, for such a lovely compliment. I'm very much thankful to all the panel members also for having me, and also to all the viewers who are watching live. Please make sure to get your auto e-participation certificate from our Facebook content, like the Facebook description. Those who are watching on Facebook, you can go over there and get the link, because in the YouTube section the wrong link has been put, so for which many of them were facing difficulties getting the auto e-participation certificate. But don't you worry, you will be getting your auto e-participation certificate from the link given in the Facebook. And those who are watching on recorded version, I guess if you are watching it on 23rd February 2026, you will be getting your link open till 11:59 p.m. and after that it will be closing. So hurry up, get your link from Facebook, and also it will be on YouTube also in description by then, post live stream, so you can check over there too. So again, with this, thank you all. Thanks for watching. I hope you have enjoyed today's CME. If you have enjoyed, please give it a like, share it with your fellow mates, and don't forget to subscribe us for more content like this. Press the bell icon to get notified as soon as we schedule. And also, you can join our WhatsApp channel. The link is in the description below to get updates on all NIH alumni activities as it's going on and on. So thank you again. Thanks for watching. Good night good night for now. See you in our next CME. Until then, it's me, Dr. Orko Mukherjee. Good night.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.